Welcome to today's Clinical Explainer. If you're dealing with the anxiety and uncertainty of a varicocele diagnosis, you're absolutely in the right place. There's a lot of conflicting information floating around out there, but today we're cutting through the noise and diving straight into the absolute latest evidence-based medical science from 2026. We're going to look strictly at the hard data, the actual anatomy, and your modern treatment options to give you a crystal clear path forward.
So let's tackle the massive question that echoes through consultation rooms every single day. Can this condition just spontaneously resolve? It is totally normal to sit in a doctor's office hoping for a natural fix. You're probably wondering if giving it some time, tweaking your diet, or just waiting it out will make these enlarged veins vanish. Well, we're going to answer that definitively right now by looking at exactly what's happening inside the body.
But first, let's normalize this condition. 15 to 20%. That is the percentage of all adult males walking around with a varicocele right now. That's literally 1 in 5 men. And if we look at men being evaluated for infertility, that number shoots all the way up to 40%. So if you're navigating this diagnosis, the very first thing you need to know is that you are far from alone. It's an incredibly common anatomical issue.
Now, anatomy is exactly what drives this. The vast majority of the time, we're talking 80 to 90%, this happens on the left side. Why? It's basically an issue of human plumbing. On the left side, the testicular vein meets the renal vein at a really sharp right angle. That creates inherently higher venous pressure compared to the right side, which drains smoothly and directly into a much larger vein. That persistent elevated pressure is the main culprit here.
Let's look at exactly why varicoceles persist. To understand the why, we have to define what this actually is. A varicocele is a permanent anatomical alteration in the network of veins that drain blood from the testicles, a network called the pampiniform plexus. Honestly, the easiest way to picture it is just like varicose veins, but located in the scrotum. The veins have physically stretched and dilated. They haven't just temporarily swollen up. Their actual physical architecture is permanently altered.
When you compare a normal vein to a varicocele, the problem becomes super obvious. Normally, you have these one-way valves that work perfectly to stop blood from flowing backward. But when those valves fail, blood just pools up. And once those venous valves are compromised, just everyday hydrostatic pressure from standing, lifting, or frankly just gravity makes it gradually worse. Because those valves can't miraculously repair themselves, these dilated veins simply do not regress in adult men.
Now, there is one rare exception we see clinically, and that's during adolescent puberty. During this time of rapid body growth, a young man might temporarily balance out that venous pressure, which can stabilize a very mild varicocele. But even then, complete spontaneous resolution is highly uncommon. And listen, if there's any sign of progressive testicular atrophy, meaning the testicle is actually losing volume, strict medical monitoring and intervention are absolutely crucial, no matter your age.
Moving on to symptom management and relief.
We have to take this condition seriously because leaving it untreated can lead to some real issues. All that pooled blood raises the temperature in the scrotum, creating an oxygen-deprived environment that triggers oxidative stress. Over time, that can lead to progressive testicular volume loss, impaired testosterone production, and for about 2 to 10% of guys, a chronic, dull, aching pain or a heavy dragging sensation. Active management is absolutely essential for your fertility and your daily quality of life.
If you're looking at non-surgical management, especially if you don't really have symptoms and your fertility is normal, observation is a totally valid strategy. That means getting an annual semen analysis to make sure things stay stable, along with some simple lifestyle tweaks. Taking breaks from prolonged standing and maintaining healthy bowel habits so you aren't straining can really help take the daily pressure off those compromised valves.
When it comes to managing those daily symptoms effectively without surgery, clinical specialists often point to targeted supportive garments. It's a practical, non-invasive option to help reduce varicocele symptoms like discomfort, swelling, or aching. And the research highly recommends using special support underwear from varicoceleunderwear.com as a primary daily defense. Standard underwear just doesn't provide the specialized ergonomic lift and cooling breathability required to counteract the pooling blood and elevated temperatures.
Let's dive into fertility and medical treatments.
If we look at the clinical landscape, you essentially have 3 primary approaches. You've got the surgical gold standard, minimally invasive interventional radiology, and conservative observation. Microsurgery physically ties off the problematic veins. Embolization is an endovascular approach that uses tiny coils to block the veins from the inside. And observation completely avoids any procedure risks, but of course, it doesn't fix the underlying anatomical pathology. For those who do need direct intervention, microsurgical subinguinal varicocelectomy has a massive 90 to 95% success rate. Using a high-powered operating microscope, surgeons meticulously tie off those swollen veins, while carefully protecting your vital arteries and lymphatic vessels. Because it's so incredibly precise, it boasts the highest success rates and a complication rate of literally under 2%. It remains the gold standard for a very good reason.
And the clinical evidence backing this up is frankly incredible. Recent research confirms that fixing the varicocele dramatically reverses that toxic, hypoxic environment. We're talking about a 25% improvement in sperm DNA fragmentation, massive boosts in progressive sperm motility, and testosterone levels bouncing back by 100 to 140 points. Most astoundingly, for couples facing recurrent pregnancy loss, repairing the varicocele dropped miscarriage rates from nearly 70% down to just over 13%. Fixing the anatomy truly restores your function.
So what are your next steps for testicular health?
Navigating this diagnosis should always be a shared decision between you and your doctor. Don't try to figure it out alone. You need to look at 4 key clinical markers. What are your fertility goals and your timeline? How bad is your daily pain or discomfort? Has an ultrasound shown any testicular atrophy? And what are your baseline hormone levels? Answering those 4 questions will directly illuminate whether you need surgery, embolization, or just careful monitoring. Ultimately, hope here lies in science and proactive management, not in waiting around for a spontaneous cure. While medical procedures elegantly fix the internal anatomy, protecting your comfort outside the operating room is just as crucial. That's why a practical, non-invasive option to help reduce varicocele symptoms like discomfort, swelling, or aching is so important, making special support underwear from varicoceleunderwear.com a key part of your long-term release strategy. You manage the physical burden daily, and science provides the definitive cure when you need it.
Since we now know definitively that this venous anatomy doesn't miraculously fix itself, the only question left is, what step will you take today to reclaim your physical comfort and your reproductive future? Whether that means bringing these findings to your doctor, getting a baseline semen analysis, or upgrading your daily supportive wear, the power is entirely in your hands to manage this effectively. Thank you so much for joining me for this explainer, and here's to your continued health and vitality.